Hi everyone, my name is Sylvester and my goal is to make complex concepts in anatomy and physiology very simple and accessible to everyone, most especially health sciences students. So if you're a health science student or someone who is just curious about getting to know more of the human body and how it works, then you are the right place. In this video, the focus is going to be on anatomical positions, anatomical planes, directional terms, the 4 quadrants of the abdomen, and the 9 anatomical regions. Let's begin. Anatomical positions. In fact, anatomical position is a standardized stance used for anatomical reference. Okay, so when we say anatomical position, it's more like a stance. So anytime we are doing anatomical study, the body is supposed to be in a certain stance. Okay, the body is supposed to be positioned in a certain way before we begin anatomical studies. And that stance, that standardized stance, is what we refer to as anatomical position. Okay, so anytime you hear anatomy, so for example, if we are looking into an anatomy textbook or reference book, okay, or an atlas, and then we are looking at the description of the position or the location of the heart, that description is based on the anatomical position. It's a stance that a human body is supposed to be assumed in before we do anatomical studies. Okay, and so we are going to look at these stances. Okay, so when we say anatomical position, it is the standardized stance that is used for anatomical reference. But let's go and look at what this anatomical position is. What position is a human body supposed to be in for us to refer to as a standardized stance in anatomy and physiology? Let's look at it. In anatomical position, look at these images over here. We have 3 images up here. We have 2 images down here. Okay. In anatomical position, the body is supposed to be erect like this. You shouldn't be sitting. The body is supposed to be erect. Okay. So in anatomical position, the body is supposed to be erect. The feet is supposed to be flat on the floor. So look at this man in the middle. You could see the feet is flat on the floor. Okay, so the body is supposed to be erect. The feet is supposed to be flat on the floor. The arms are the size of the body. So the arms of the person supposed to be at the size of the body, with the palms, okay, the face, and then the eyes facing forward or pointing forward. This is what we refer to as anatomical position. Okay, the body is supposed to be erect. So in anatomical position, when we are doing anatomical study, the body shouldn't be assumed in a certain position. No. If you assume the body in a certain position, and in anatomy you are describing the thigh, you end up describing the thigh's position in a different angle. That is the reason why we say in anatomical position, which is the standardized stance for anatomical reference, the body is supposed to be erect, standing straight, erect. Okay, good. And then the feet is supposed to be flat on the floor. The person is not supposed to be limping or standing on just the toe. Okay, the feet is supposed to be flat on the floor, like this image over here. You could see that clearly in this image over here. The feet should be flat on the floor. The arms on each side of the body. So you could see the arms over here on each side of the body. And with the arms being on each side of the body, the arms should not be pointing opposite the body, the direction of the body. The arms should be pointing forward. The face and the eyes should all be pointing forward. Okay, that is what we refer to as the anatomical position. Okay, so if you are asked to define anatomical position, the anatomical position is when the body is erect with the feet or both feet flat on the floor, the arms on each side of the body with the palms, face, and eyes facing forward. This is the definition of anatomical position. This is what we call anatomical position. In fact, anatomical position is very important because it gives anatomists or practitioners, health practitioners all over the world, a clear and consistent frame of reference for describing body structures and orientation, so that how someone would describe the location of the heart in United States of America wouldn't differ from how the heart location would be described in United Kingdom. It will be the same. Okay, so it's a standardized position for reference in anatomy and physiology. Okay, so it provides a clear and consistent frame of reference for describing body structures and orientation all over the world, or in all regions of the world. Okay, so for example, after we are really certain of the anatomical position, the thymus is superior to the heart. The thymus is superior to the heart. Okay, this means that the thymus is on top of the heart. Superior means above or on top of the heart. The sternum is anterior to the heart, meaning the sternum is in front. Okay, so when we say the sternum is anterior to the heart, it means the sternum is in front of the heart. The aorta is posterior to the heart, meaning the aorta is behind. If you say something is posterior, meaning behind. So now we are going to look at, based on the anatomical positions, okay, we would now be able to give directional terms. Okay, so before we give directional terms to various organs in the body, we do that considering the reference point, which is the anatomical position. Okay, good. So we are now going to go further to look at some directional terms in anatomy and physiology. Now, the first thing, let's look at supine versus prone positions. Supine versus prone positions. Now, remember that these positions are not anatomical. This position is not an anatomical position. It's also a different position, supine versus prone position. Let's first of all look at the supine position. Supine position with the body facing up, the palms also facing up. Okay, good. So this is what we call the supine position. So supine position, you can see the person is lying flat on the back, okay, with the face facing up. Both arms should also be facing up. Okay, good. This is what we call supine position. So this position you see over here is the supine position. Okay, so the position with the face facing upward, the palms also facing upward. This is what we call supine position. Okay, prone position. Prone position is when the body is facing downward. Okay, so a position with the body facing downward. Okay, this is what we call prone position. Prone position. So this is also supine position. You can see the person is lying flat on the back. This person is lying flat on the front. Then the back is facing upward. So you can see the back of this person is rather facing upward. But then the back of this person is facing downward. Okay, good. And then you can see the face is facing upward. The face is facing upward. If you say supine, it means on the back. Supine means lying on the back. Okay, good. Prone means lying on the front. So you can see this person is lying on the front. Okay, prone position. Okay, so prone versus supine position. Now let's look at anatomical planes. Okay, before you begin to go deeper into anatomy and physiology concept, to start to look at organs, tissue, it's very important that you understand this topic, anatomical planes. Okay, good, because sometimes you may have to be describing organs in relation to other structures or organs in the body, and your understanding of these anatomical planes are very important. Anatomical planes and directional terms. Okay, and if you want to be very good in anatomy, you should have a very good knowledge of these anatomical planes. Now, when we say anatomical planes, they are like imaginary lines that divide the body into sections to help us describe the location of structures and the direction of their movement. So anatomical planes are not things that are physically present in the body. They are sort of imaginary lines that we assume to divide the body into various sections, especially when we are doing anatomical studies. Okay, so anatomical planes are like, they are imaginary lines that divide the body into sections to describe the location of structures and their direction of movement. That is what we refer to as anatomical planes. In fact, we have three major anatomical planes. There are three major anatomical planes in anatomy and physiology. Three major anatomical planes. We have the sagittal or the lateral plane. We have the frontal or coronal plane. We have the transverse or horizontal plane. These are the three major anatomical planes. Okay, the sagittal or lateral plane, the frontal or coronal plane, the transverse or horizontal plane. These are the three major anatomical planes. Now, what is a sagittal plane? A sagittal plane is actually a vertical plane. Vertical, we are using the word vertical plane. Vertical, meaning it is coming from top to down. From top to down. So anytime you hear sagittal plane, first of all, you should understand that this is a plane that is cutting from top to down. It's an imaginary line dividing the body into two sections from top to down. So that means that if something is dividing, if an imaginary line is dividing the body from top to down, it is going to give us left and right portions. Left and right portions. Okay, so a sagittal or lateral plane, okay, these vertical planes divide the body into right and left parts. Okay, because if we are using the word vertical plane, so a sagittal plane is a vertical or lateral plane, meaning it divides the body from top. This plane is coming from top to down. So that means that it is going to divide the body into right and left portions. Okay, good. This is a sagittal plane. This, the very green, the deep green, that's the sagittal plane. So you could see that it is cutting the body from top to down, from top to down, from top to down. Okay, and it is giving us this portion, the left and then the right, the right and then the left portion. So a sagittal plane are actually vertical planes that divides the body into right and left portions. Let's look at it over here. Sagittal plane. So you can see it is cutting through the body from top to down, vertical, and it is giving us right and then left portions. That is what we call a sagittal plane. Now, if a sagittal plane divides the body into two equal halves, we call it a mid-sagittal plane. So the moment a sagittal plane can divide the body into two unequal halves. Okay, that is what you should keep in your mind. You can have a sagittal plane which is dividing the body into two unequal halves. But anytime you have a sagittal plane dividing the body into two equal halves, we call that a mid-sagittal plane. Mid-sagittal plane or middle sagittal plane. Okay, so for example, this is a mid-sagittal plane. Even though it's a sagittal plane, but because it's dividing the body into two equal halves, okay, it's a mid-sagittal plane. A mid-sagittal plane. Okay, good. So a sagittal plane divides the body. It's a vertical plane that divides the body into right and left portion. So you can see the right portion over, right half over here, and then the left half over here, so that we get right and left portions. Okay, good. Then we have the frontal or coronal plane. Okay, the frontal or coronal plane is also a vertical plane. Okay, but the difference is that the frontal or coronal plane divides the body into front and back portions. Okay, this is it. So this is the frontal or coronal plane. So you could see it's also vertical, but the difference is that it will cut through from top to down, but it will give us front and back portions. Okay, front and back portions. That is what we call the frontal or conal plane. It's just similar to the sagittal plane, just that the sagittal plane will cut it from top to down, but at the end of the day, it will give us right and left portions. Okay, the frontal plane, however, would cut the body into two, but then it will cut it in an angle that it will give us front and back portions. There are two different planes altogether. One is going to cut, the sagittal will cut and give us right and left halves, but the frontal will cut and give us front and back portions. They are two different things, even though they are all vertical planes. So both the sagittal plane and then the frontal or conal plane are all vertical planes. Okay, and don't forget that a sagittal plane that divides the body into two equal halves is called a mid-sagittal plane. A mid-sagittal plane. Okay, then we have the odd one, which is the transverse plane. The transverse plane is rather not vertical, but then it's a horizontal plane. Okay, so the two are all vertical planes. Sagittal plane is a vertical plane. Frontal plane is also a vertical plane. Transverse plane is a horizontal plane that divides the body into upper and lower portions. So you could see it is cutting the body through the body, and it is giving us upper portion, which is the superior portion, and lower portion, which is the inferior portion. Okay, so a transverse plane, so this is a transverse plane in this diagram. Transverse plane, this one is cutting through in the middle. So it is cutting through the body and giving us superior portion, which is from here to here, and then inferior portion, which is from here to here. So it will give us upper portion and then lower portion. This is what we call transverse plane. So over here, this is the transverse plane. You can see it is cutting through the body and giving us upper portion, which is the superior portion, and then lower portion, which is the inferior portion. Okay, so a transverse plane is a plane, is a horizontal plane that divides the body and give us superior portions and then inferior portion. It's the planes are not necessarily supposed to cut through in the middle. Okay, we can have a transverse plane going through at this angle, at this side of the body. You can have a transverse plane going through over here. They are imaginary planes. Okay, so in summary, we have three major planes in anatomy and physiology. We have the sagittal plane, the coronal plane, the sagittal plane or the lateral plane, the coronal plane or the frontal plane, and then the transverse planes. The sagittal and the conal planes are all vertical planes. So you could see vertical planes, meaning those planes runs from top to down. You could see the frontal plane also runs from top to down. The difference is that the sagittal plane at the end of the day will divide the body into right and left portions. It could be equal or unequal. Okay, the frontal plane also will divide the body into front and back portions. Okay, anterior, okay, and then posterior portion. It will divide the body and give us anterior and posterior. That is also another way of defining frontal plane. It will divide the body and give us anterior portion and posterior portion. Okay, the sagittal plane will divide the body and give us two lateral portions, the right lateral and then the left lateral portion. That is the sagittal plane. It will divide, that is why we call it the lateral planes. It will divide the body and give us two lateral portions, the right lateral and then the left lateral. This one will divide the body. The frontal plane will divide the body and give us the anterior portion and then the posterior portion, or the front and then the back. Okay, good. The transverse plane will divide the body and give us top and down, the superior portion, which is the upper portion, and then the lower portion, which is the inferior portion. Okay, so like I said, we have the mid-sagittal. So the sagittal plane divides the body. It's a vertical plane that divides the body into right and left portions. I told you if a sagittal plane divides the body, okay, and give us equal right portion and equal left portion. We call it a mid-sagittal plane. Some books, they call it the median plane. The median plane. The median plane. So when you see mid-sagittal plane or median plane, it's a type of sagittal plane. It divides the body. So for example, this one you see over here is a median plane or a mid-sagittal plane. Even though it's a sagittal plane, what you should know is it's a sagittal plane, just that because it is dividing the body into equal right and left portions, it becomes a median sagittal plane or a mid-sagittal plane. Then we have parasagittal plane. Okay, a parasagittal plane actually divides the body into unequal right and left portions. Okay, so any plane that divides the body, a sagittal plane. So for example, if this plane, it wasn't cutting through the body from top to down equally, it was cutting through somewhere from the angle of the right breast. It is cutting through from the point of the nipple of the right breast. We will call it a parasagittal plane. So a sagittal plane that divides the body into two unequal halves, we call it a parasagittal plane. Please keep it in your mind. A sagittal plane that divides the body into two unequal halves, we call it a parasagittal plane. But when it divides the body into two equal halves, we call it a mid-sagittal plane or a median sagittal plane or a median plane. Now let's go and look at directional terms in human anatomy and physiology. Directional terms in anatomy. Now when we say directional terms in anatomy, directional terms actually describe the location of structures relative to other structures or locations in the body. Okay, so the location of structures relative. So when we say directional terms, we are trying to give a location of a particular structure, okay, or a particular organ in the body relative to other structures. That is what we refer to as directional terms. Okay, and directional terms also provide a standardized way to discuss positions in anatomy, positions of organs, positions of tissues, their relationship with other organs and parts of anatomical structures. Now let's go and look at some directional terms we have in anatomy. Superior, the first one is superior and inferior. Superior means something is above. So when we see an organ is superior to the other, it means the organ is above another organ. Okay, so superior means above. Inferior means below. Okay, superior means above. Inferior means below. Okay, anterior or ventral. If you say anterior, another word for anterior is ventral. When we say ventral or anterior, it means in front. Ventral or anterior means in front. So when we say that the heart is in front of the aorta, it means the heart is anterior to the aorta. It means the heart is in front of the aorta. Okay, good. So anterior or ventral, another word for anterior is ventral. Posterior or dorsal, another word for posterior in anatomy and physiology is dorsal. So when you see this dorsal, it means posterior, behind or at the back. Okay, front and back of the body. Medial or lateral, if you say medial, it means towards the midline. Okay, lateral means away from the midline. Okay, so medial, if you say something is medial, meaning that thing is towards the midline or within the midline. If you say something is lateral, meaning it's away from the midline. Lateral means away from the midline. Medial means towards the midline. Okay, medial means the sternum is medial, okay, to the lungs. Okay, meaning it's towards the midline in between the lungs. Okay, proximal and distal. Proximal and distal. Proximal means closer to or further away from the midpoint. Okay, proximal is when something is closer to the midpoint. Okay, distal is when something is far away from the midpoint. Okay, or what we call the point of attachment. Okay, good. Let's move on And now look at some examples. I mentioned that ventral means anterior. Okay, so ventral means toward the front or the belly. If you say something is ventral, so these are some directional terms in human anatomy. And we say something is ventral, meaning towards the front. Ventral, it means anterior, in front. Anterior, in front. Okay. Dorsal is the same as posterior, towards the back or supine or the spine. Okay, towards the back. Dorsal means towards the back. Anterior. Okay. Anterior is the same as ventral. We've explained that. Posterior is the same as dorsal. Superior means above. Inferior means below. Superior means above. Okay. Or upper. Above or upper. Inferior means below or lower. Medial means the middle plane, towards the middle plane, towards the midline, towards the middle. Lateral means away from the median plane or away from the middle. Proximal means closer to point of attachment. If you say something is proximal, meaning closer to where there is an attachment. So when we say that the elbow is proximal to the shoulder joints, the elbow is proximal to the shoulder, it means that the elbow is closer to the point of attachment. Okay, it's closer to the point of attachment of the shoulder. Okay, good. So if you say something is proximal, meaning that thing is closer to where there is an attachment, where there is a point of attachment. Okay, good. If you say something is distal, the fingers are distal to the shoulders, meaning it's a bit far away from the point of attachment. Okay, good. So proximal means closer to the point of attachment. Distal means further away from the point of attachment. Superior meaning closer to the body surface. If you say something is superficial, it means that it is closer to the body surface. Superficial. So for example, the skin is superficial to the muscles. The skin is superficial to the muscles. Deep meaning further away from the body surface. The bones are deep to the muscles. Here's a perfect example. Okay, so ventral. The aorta is ventral to the column. The aorta is ventral to the vertebral column. The aorta is ventral to the vertebral column, meaning the aorta is anterior to the vertebral column. It's in front of the vertebral column. Dorsal. Dorsal means towards the back or posterior. The vertebral column is dorsal to the aorta. You see, we've interchanged it and it makes sense in anatomy. The vertebral column is dorsal to the aorta, meaning the vertebral column is behind, it's at the back of the aorta. Excellent example. Anterior means towards the front, is the same as ventral. The sternum is anterior to the heart. You see, this is the example that I gave. The sternum is anterior to the heart. Okay, towards the front of the heart. Posterior. The esophagus is posterior to the trachea. The esophagus is posterior to the trachea, meaning the esophagus is behind the trachea. The esophagus is posterior to the trachea, meaning the esophagus is behind. Okay, superior, above. The heart is superior to the diaphragm, meaning the heart is above the diaphragm. Superior to the diaphragm. Inferior means below. The liver is inferior to the diaphragm. The liver is inferior to the diaphragm. Medial. The heart is medial to the lungs. Okay, medial means towards the median plane or the middle line. Okay, good. So these are some anatomical planes that these are further directional descriptive terms for human body parts and positions. So if you see the word antebrachial, we are talking about the forearm. Antebrachial is the forearm. Antecubital, front of the elbow. Okay, good, front of the elbow. Axillary means the armpit. Axillary is the armpit. Brachial is the upper arm, brachial. Buccal in anatomy means mouth. Buccal or oral means mouth. Cardiac means the heart. Cervical refers to the neck. Cranial refers to the head. Cutaneous refers to the skin. Deltoid refers to the shoulder. Femoral refers to the thigh. Frontal refers to the forehead. Okay. Gastric refers to the stomach. Gluteal refers to the buttocks. Hepatic refers to the liver. Iliac refers to the hip. Inguinal refers to the groin. Lumbar refers to small of back. Mammary refers to breast. Nasal refers to the nose. Occipital refers to back of the head. Orbital refers to the eyes. Parietal is the crown of the head. Kneecap is patella. Patella means kneecap. Pectoral means the chest. Pedal means the foot. Perineal means the pelvic floor. Plantar means the sole of the foot. Popliteal means the back of the knee. Pulmonary means the lungs. Renal means the kidney. Sacral refers to base of the spine. Scapula refers to shoulder blade. Sternal refers to the breastbone. Temporal refers to side of the head. Umbilical refers to the navel. Volar or palmar refers to the palm. Okay, good. So these are some further examples. So superior, inferior, below, anterior towards the front, posterior towards the back, ventral, dorsal towards the back, medial towards the midline, lateral away from the midline, internal meaning within, external meaning outside. Okay, so the brain is internal to the skull, and then the ribs are external to the lungs. Okay, superficial towards the surface. The skin is the most superficial organ. Deep, within or interior. Okay, so deep is just similar to interior sometimes, depending on the description that you are given. Central means the main part. Central, the brain is part of the central nervous system. So if you say central organs of digestion, meaning the main organs of digestion. So in anatomy, if you see the word central, we are talking about main parts. The central organs of the nervous system. The central organ of the renal system. Okay, so these are descriptive terms that you have to be using when you are talking anatomy and physiology. Okay, good. So these are some of the descriptive terms. So cranial meaning the head. Facial, the face. Cervical, the neck. Okay, acromial, the shoulders. Pectoral, the chest. Sternal, the sternum. Umbilical, abdominal. Okay, antecubital, brachial, axillary. This is axillary. Okay, antecubital. This is brachial. This side is brachial. This side is antebrachial. And then this is carpal. This is palmar, the hand. In anatomy, you call it palmar. Don't say palm, say palmar. Okay, palmar region. Femoral region. This is the femoral region. This is the patellar region, or what we call the kneecap region. Crural region. Okay, this is the tarsal region. And then this is the dorsal of the foot. Okay, good. So all this is the lower limb. All this is the lower limb. All this is the upper limb. The green, all the green is the upper limb. Okay, thoracic region. This is the thoracic region. Scapula. Okay, vertebral region. This is the vertebral region. Sacral region. This is the sacral region, the red. Okay, good. And the buttocks is the gluteal region. Gluteal region. Gluteal region, the buttocks. Lumbar region. Okay, this is the lumbar region. This is the olecraneal region here. Olecraneal region. Vertebral region here, the vertebral region. Okay, the cranial region, the head. The cranial region. The scapular region. This is the scapula. Scapula. This is thoracic. This region is thoracic. This region is the sural region. Sural region. Sural. And here is the popliteal region. And then in front is the patellar region. Okay, and this is the plantar region. Here is palmar. The hand is palmar. The foot or the feet is the plantar region. Plantar region. Okay, so these are some descriptive terms for human body parts. Let's look at more diagrams over here. Let's look at more diagrams. So from the top, we have the head. Okay, so here is the frontal region of the head. Frontal region of the head. This is the cranial region of the head. The cranial region of the head. Buccal region. Okay, buccal region, the cheeks. The cheeks is what we refer to as the buccal region, the cheeks. The buccal region, the cheeks. Okay, the facial region, the face, the facial region. Okay, the mouth or the oral cavity, the mouth. Okay, then we have the mentis or the chin. The mentis is what we refer to as the chin. The mentis or the chin here, this side. The mentis or the chin. The mentis or the chin. We have the axillary or the armpit. Here is the axillary or the armpit. The axillary or the armpit. So the axillary or the armpit. Okay, so that's the armpit. Okay, then we have the brachial region. This is the brachial region. This region is what we call the brachial or arm. Okay, this is what we refer to as the forearm. This region is the forearm. So in between the arm, okay, and then the forearm, we have the antecubital. Okay, antecubital. Okay, and then behind the antecubital we have posterior cubital. Okay, good. So this is the antecubital. Okay, good. So this is the forearm or the antebrachial. Okay, so over here, so over here we call it the arm or the brachial, and here is the antebrachial. Okay, then we have the capus or the carpal over here. Okay, or the wrist. This is what we refer to as the wrist, where we usually fix our wrist watches and all that. Good. So here we refer to this region as the palmar or the palm. Okay, so behind the antecubital, I said in between the arm, which is the brachial, and then the forearm, which is the antebrachial, is the antecubital, which is in front. But behind, we call it the behind. Okay, we call it the elbow. Okay, the elbow, or you can refer to it that as the olecranon, or olecranal. That is it. Good. So this is the palmar. This region is the palmar or the palm. But then we call the fingers the digites or the phalanges. Okay, the digites or the phalangeal region. Okay, good. Then this one we call this side. All these side is the lower limb. From this side to this side is the lower limb. From this side to this side, all refers to as the lower limbs. Okay, the lower limbs. All right, so we have the thoracic region. This is the thoracic region or the thorax. The mammary region or the breast, the mammary region. The abdominal region. This is the abdominal region. This is the umbilicus. This is the hip region or the coxal region. This side where we fix our belts. The coxal region or the hip. Okay, we have the pelvic region. Below the hip is the pelvic region. Okay, then we have the groin. Okay, the groin or the inguinal region. Then we have the pubic region. This is the pubic region. This is the femur bone. The femur, or how we refer to as the thigh. This side. From this side to this side, refers to as the femur or the thigh, the femur region or the thigh. Then from the femur region or the thigh, we have the patella or the kneecap, patella region or the kneecap. Then below the patella region, we have the crural region, from the patella to the tarsus or the tarsal region. We call it the crural region, the crural region, the crural region. And this side is the tarsal. I mentioned that here is the carpal or the carpus, the wrist. What we refer to as the wrist is the carpal or the carpus. Then we have the digits or the phalanges. This is the digits or the phalanges. Okay, at the hand we have the digits as well, or the phalanges or the fingers. But for the leg is the toes. It's also digits or phalanges. Okay, so this side is the tarsus or the tarsal region, this side. Okay, then we have the digits or the phalanges, the phalangeal region. Okay, good. Then the toes, we call it the big toe. In anatomy, we call it the hallux or the great toe. The hallux or the great toe. The very big toe, we call it the hallux or the great toe. Okay, so you could see that this body is in anatomical position. If you've observed what we are doing very well, this body is in anatomical position. So you see, the body is supposed to be in anatomical position before we can do descriptive terms of body parts and areas. Okay, so we come to the back. We have the cephalic, the head. From this region to this region, we refer to as the cephalic. Okay, cephalic region. The shoulder is also called acromial region. The shoulder region, we call it in anatomy acromial region. And then the neck region, we call it the cervical region. Cervical. So when you hear cervical in anatomy and physiology, it means that thing is related to the neck. If you hear cervical, something that is related to the neck. Cervical is related to the neck. Cervical or the neck. From this side to this side, we call it the upper limb. From this side to this side, that we are talking about the hand. Okay, so the upper limb, from this side to this side, the upper limb. From this side to this side, the upper limb. The upper limb is not from here to here. That is the trunk. Here to this side is the trunk. From here to here is the trunk. The upper limb is from the acromial, which is the shoulder, to the palmar of the hand, or the digits. Okay, the digits. That is what we refer to as the upper limb. So the upper limbs are two: the right upper limb, the left upper. Then the lower limbs, from this side to this side, and then from this side to this side. The lower limbs are also two. Okay, so the buttocks is called the gluteal or the buttocks. Gluteal or the buttocks. Okay, gluteal or the buttocks. The back is called dorsum or back, or dorsal. Dorsum or back, or dorsal. Okay, the lumbar region, this side is what we call the lumbar region. So just at the top of the gluteal region or the buttocks, we have the lumbar region. This side of your back is what we refer to as the lumbar region. And this side, just this downside where you usually sit on, is the sacral region. The sacral region. The sacral region. This side. Okay, so these are some. So like I said, this side to this side is the trunk. This side to this side is the trunk. This side of the body to this side of the body is the trunk. This side to this side of the body. So this whole area is the trunk. This whole area is the trunk of the body. This whole area is the trunk of the body. This whole area is the trunk of the body. Good. Now let's look at the human body regions. The human body regions. Okay. Now in anatomy, in human anatomy and physiology, the human body can be divided into two regions: the axial region and then the appendicular region. Okay, so this is the axial region here, the trunk. This side is what we call the axial region. This side is referred to as the axial region. And then the appendicular region consists of the upper limbs and then the lower limbs, the appendicular region. So the axial region includes the head, the neck, and then the trunk. So in anatomy, when we say axial region, in fact, the human body can be divided into two regions: the head, the neck, and then the trunk. From here, where the cursor is going round, we call those regions the axial region. So when you hear axial region, so if you are describing the head, you can even say the head is in the axial region of the body. The neck is in the axial region of the body. The abdomen is in the axial region of the body. So the head, the neck, and then the trunk. This is the axial region. The appendicular region consists of the left upper limb, the right upper limb, the right lower limb, and then the left lower limb. This is what we call the appendicular region. So the axial region consists of the head, the neck, and the trunk. Okay, good. And the appendicular region contains the limbs, which is the upper limb, that is the arm, the forearm, the wrist, the hands, and the fingers, the lower limb. So the body can basically be divided into two. The human body can basically be divided into two broad regions: the axial region, which consists of the head, the neck, and then the trunk. This is the trunk. Okay, and then the appendicular region, which consists of the two upper limbs, the right limb, upper limb, the left upper limb, the right lower limb, and then the left lower limb. This is what we refer to as the appendicular region. The appendicular region. So we have two regions of the body: the axial region and then appendicular region. So the head is part of the axial region, the neck is part of the axial region, then the trunk is also part of the axial region. Then the appendicular region, we have this side of the body, that side of the body, this part to the foot, and then this part to the foot. Now let's look at the abdominal quadrants. The abdominal quadrants. Abdominal quadrants. If you say a quadrant, meaning dividing something into four equal parts. Okay, so we have four abdominal quadrants. Okay, in the body we have four abdominal quadrants. In fact, putting the body or dividing the body imaginarily into these quadrants help us in describing the location of various organs in the body, okay, or certain organs in the body. Okay, so if you look at the abdomen of the human body, we can divide the abdomen into four quadrants. So let's look at this diagram. We can divide the abdomen into four: 1, 2, so that we get this quadrant, that quadrant, and then that quadrant. Okay, so we have four abdominal quadrants: the right upper quadrant, the left upper quadrant, the right lower quadrant, and then the left lower quadrant. So in effect, keep it in your mind that we can divide the abdomen imaginarily, okay, so that we can divide it into two, then we get four quadrants. Okay, we can divide it into two, this way, that way, so that we get four quadrants. Okay, so before you get abdominal quadrants, it means we have to divide the body across into two. Okay, good. So let's look at the four abdominal quadrants. So this is the four abdominal quadrants. So you can see we use a median plane. Okay, so before, okay, and this is a multiple choice question. Before you can get the four abdominal quadrants, it means we have to divide the body using a mid-sagittal plane, a median plane, and then a transverse plane. Okay, so you see a median plane over here, and then a transverse plane. This transverse plane, that actually gives us the four abdominal quadrants. We call that transverse plane specifically transumbilical plane, meaning that plane have to cut through the umbilicus. So we don't just get the four abdominal quadrants. You have to go further. Okay, so to get the four abdominal quadrants, you should get a median plane or a mid-sagittal plane. Okay, that passes through the umbilicus, and then you should get a transverse plane that also passes through the umbilicus. We call that transverse plane a transumbilical plane. Okay, good. So these planes will give us the four abdominal quadrants, and these are the four abdominal quadrants: the right upper quadrant, the left upper quadrant, the right lower quadrant, and then the left lower quadrant. So if you are asked in exams to list the four abdominal quadrants, these are the four abdominal quadrants: the right upper quadrant. Here is the right upper quadrant. Right upper quadrants. So the upper parts are the upper quadrants. So we have two upper quadrants, the right upper quadrant and left upper quadrant. And we have two lower quadrants, right lower quadrants and then left lower quadrants. So the quadrants are four. Two of them are up and two of them are down. The ones that are up are the upper quadrant. So depending on the position, if it is right upper quadrant, if it is left upper quadrant. If you come down, the right lower quadrant and then the left lower quadrant. Now, this division is very important in helping us to identify the location of these abdominal organs or abdominal organs. Okay, so in exams or in practice, sometimes you can be asked to mention or you may be required to identify certain organs within certain quadrants in practice. Okay, so the right upper quadrant, we have some abdominal organs that are located in the right upper quadrant. So in the right upper quadrant, we have a portion of the liver in the right upper quadrant. We have a portion of the gallbladder in the right upper quadrant. We have a portion of the right kidney also in the right upper quadrant. Part of the stomach is there, small intestine is there, and large intestine is. So let's look at it. Okay, so the liver, a portion of the liver is in the right upper quadrant. So the right liver is in the right upper quadrant. Okay, a portion of the stomach, a portion of the small intestine, a portion of the large intestine, the liver, a portion of the liver is also in the right upper quadrant. Okay, and then the gallbladder, you can see the gallbladder over here in the right upper quadrant. When we come to the left upper quadrant, we have a portion of the stomach, a portion of the small intestine, a portion of the large intestine, a portion of the left kidney. Okay, all in there. So you can see a portion of the stomach, a portion of the spleen, the left kidney, the pancreas, part of the pancreas, okay, part of the liver, the large small intestine, the large intestine, all are in the left lower quadrant. So you can see a portion of the stomach in the left lower quadrant, a portion of the large intestine, a portion of the small intestine, the spleen is also a portion of the pancreas, the liver are all found in exams. They can ask you to list the four quadrants of the body, of the abdomen, and then you mention like 4 or 5 organs that can be found or located in each of those quadrants. Let's go to the right lower quadrant. You can see, you definitely see a portion of the large intestine, a portion of the small intestine. We can see a portion of the rectum. We can see a portion of the bladder will definitely be there. Okay, so the right lower quadrant, the appendix is there, the right ovary for the female, the right ureter, the cecum, part of the small intestine, and part of the large intestine. The left lower quadrant, you can see a portion of the small intestine, a portion of the large intestine, a portion of the, you can have a portion of the left urethra would also be there, sigmoid colon will also be there. Okay, where is the appendix located? Very important, the right lower quadrant. Please, where the appendix is located is very important to you in medicine and surgery. Okay, you can see the appendix is located in the right lower quadrant, the right lower quadrant, the right lower quadrant. Where is the stomach located? A portion of the stomach can be located in the right upper quadrant, and other portions can also be located in the left lower quadrant. Okay, so if a patient is having any problem with the stomach, that patient is not likely to experience lower quadrant abdominal pain or lower abdominal pain. They will usually experience epigastric pain. Okay, a pain in the upper quadrant, a pain which is very pronounced in the upper quadrant. Okay, so right lower quadrant, that is where the appendix is located. Right lower quadrant. Okay, apart from the appendix, we have other structures like a portion of the small intestine, a portion of the large intestine, the right ureters. All of them are inside the right lower quadrant. Okay, good. So this is what we refer to as abdominal quadrants. Now, the abdomen can further be divided again, but this time into 9 regions. Okay, so when we are talking about the 4 divisions, we call it quadrants. But when we are talking about dividing it to get 9 portions, you won't call it quadrants. We call it 9 abdominal regions. Okay, 9 abdominal regions. Okay, good. So these are the 9 abdominal regions. These are the 9 abdominal regions. Okay, so we divide the abdomen to get 9 regions. So 1, 2, 3, 4, 5, 6, 7, 8, and 9. Okay, so how many rows do we have? If you divide it into 9, okay, how many rows are we going to have? This is the first row, this is the second row, this is the third row. It is very easier when you learn it according to the rows. So the first row, how many regions do we have? We have the right hypochondriac region, the epigastric region, and then the left hypochondriac region. The second row, what are the regions? We have the right lumbar region, umbilical region, and left lumbar region. The third row, what are the regions? The right iliac region, hypogastric region, and then the left iliac region. So it is very advisable that you divide it into rows. So we have 3 rows. So the 9 abdominal regions, how many rows do we have? We have 3 rows, 1, 2, 3, or row 1, row 2, and then row 3. Okay, row 1, row 2, and then row 3. Okay, now then you go further to identify the regions that are in each of these 3 rows. So row 1, we have 3 regions. Row 2, we have 3 regions. Row 3, we have 3 regions. Row 1, we have the right hypochondriac region, epigastric region, and then the left hypochondriac region. Row 3, we have the right lumbar region, umbilical region, and then the left lumbar region. Okay, row 3, we have the right iliac region, hypogastric region, and then the left iliac region. Now another simple way to grab this is that we have the hypochondriac, the lumbar, and then the iliac. For each of these 3, we have the right and then the left region. For each of these 3, the hypochondriac, the lumbar, the hypochondriac region, the lumbar region, and then the iliac region. So that you know that the moment you remember hypochondriac region, you know that we have the right hypochondriac region and then the left hypochondriac region. Okay, then you go further to learn the middle ones. Okay, so hypochondriac region, that is from the top. Hypochondriac, the lumbar, and then the iliac. Okay, hypochondriac, the lumbar region, and then the iliac region. That is HLI. 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 Hypochondriac region, the lumbar region, and then the iliac region. Then after learning that, you understand that we have the right region for this structures and then the left portions for these structures. So we have right hypochondriac region, left hypochondriac region, the right lumbar region, and then the left lumbar region. The right iliac region, and then the left iliac region. Then the middle, from the top, we have epigastric, umbilical, and then the hypogastric. Epi and hypo. Epi at the top, hypo down. Epigastric region, hypogastric region. And then the middle is the umbilical region. So these are the 9 abdominal quadrants. And if you divide the abdomen into the 9 abdominal regions. The 9 abdominal regions. So I mentioned that if you are dealing with regions, we don't use quadrants, we use regions. If you are dealing with dividing the abdomen into 9, we don't use quadrants, we use regions. But if you are dividing the body into 4, then we use quadrants. Okay, so these are the abdominal regions and the various structures that are located within those regions. So at the right hypochondriac region, we have a portion of the liver, a portion of the right kidney, the gallbladder, the large or the small intestine, a portion of the large and the small intestine. The epigastric region, we have a portion of the liver, a portion of the stomach, the spleen, the duodenum, the adrenal glands, and then the pancreas. Okay, the left hypochondriac region, we have a portion of the liver, we have the stomach, a portion of the pancreas, a portion of the left kidney, the spleen, a portion of the large and small intestine. Okay, good. Then we have the right lumbar region. We have a portion of the ascending colon, we have the small intestine and the right kidney. The umbilical region, we have the duodenum, the small intestine, and then the transverse colon. The left lumbar region, we have the descending colon, we have the small intestine, and then the left kidneys. The right iliac region, we have the appendix, the cecum, the ascending colon, and then the small intestines. The hypogastric region, we have the bladder, the sigmoid colon, the small intestine, and then the reproductive organs. The left iliac region, we have the sigmoid colon, the descending colon, and then the small intestines. Okay, so these are the 9 abdominal regions and key organs that are located within these regions. The 9 abdominal regions and the key organs that are located within these regions. Good. Okay, so this brings us to the end of lesson 3 on human anatomy and physiology. Please support this channel by clicking on the like button, subscribing to the channel, and then sharing our contents to family and friends. Enjoy the rest of your time, and subscribe to the channel in order to get alerts when we upload a new video. Thank you so much.